Now, a second COVID-19 wave is ravaging Europe, forcing many countries back into lockdown. Here on South African soil, scientists are warning against fatigue and complacency as we approach the festive season, where many see it as a time for year-end functions as well as spending time with family. Now, let's discuss the repercussions of this with the Wits vaccinology professor, Professor Shabir Madhi. Good to have you with us this afternoon, Professor. One of the sentiments that has been expressed is the phrase COVID fatigue when it comes to South Africans. Are we really experiencing much of that COVID fatigue?
So, good afternoon to you. So I guess it's really an issue of whether we are experiencing COVID fatigue or whether there's complacency that's setting in. But on both accounts, whether it's fatigue or complacency that's setting in, we're not out of the woods when it comes to COVID-19. As you mentioned, what is being currently experienced in Europe is highly likely to transpire in South Africa, even if not at the same magnitude as what is being experienced in Europe. So COVID-19 has not gone away. The amount of community transmission that's ongoing in South Africa still remains of concern. The first wave itself hasn't subsided, and what we've already been observing as an example in Nelson Mandela Bay in the Eastern Cape is a significant resurgence which is leading to an increase in number of hospitalizations. Unfortunately, if we continue being complacent about what is required of us to try to slow the rate of transmission of the virus, we can expect to experience similar sorts of resurgences in other parts of the country.
Now, Professor, what would a resurgence of COVID-19 look like as far as the symptoms are concerned, as far as the severity of the virus in the body, and this in comparison to how COVID-19 manifested itself or manifests itself right now in the first wave?
So the clinical presentation of COVID-19 is unlikely to differ much. People will still develop the same sort of signs and symptoms. What might change is the number of people that end up being hospitalized. So in the first wave, there was a significant number of people that were hospitalized, as well as a relatively high mortality rate from COVID-19 in South Africa. But inadvertently, what occurred in the first wave is in the major urban metro areas in South Africa, probably up to 1/3 of individuals might have been infected. So that will somewhat assist us in terms of what we could expect when it comes to a resurgence, in that the number of severe cases, the number of COVID-19 deaths is likely to be not as bad as what we experienced the first time around. But that is not an excuse for us to try to minimize the number of hospitalizations and the number of people that die from COVID-19 when a resurgence does occur in South Africa.
I mean, just last week, Professor Madhi, about 10,000 new COVID-19 cases reported in South Africa. How are we faring as a country in dealing with this scourge?
Right. So I think one of the challenges that we've always faced in South Africa in terms of being able to quantify the exact number of people that are infected with the virus is the rate of testing, which in fact over the past 6 to 8 weeks has actually declined quite significantly. So at the time of the peak of the outbreak, we were testing close on to 50,000 individuals per day, and that has now subsided to about 20,000. So the numbers that we presented to us in terms of the number of people with COVID-19, in all likelihood, is an underestimate. But what remains of concern in South Africa is that even though we sort of on the tail end of the first wave, we sort of plateauing off at a level which is fairly high compared to where they had plateaued off in Europe after their first wave. So their counts towards the end of their first wave was in the hundreds, whereas, as you mentioned, we sort of between 1,500 and 2,000 new cases per day. So again, just to emphasize that COVID-19 has not gone away. The behavior of South Africans might suggest otherwise, but unfortunately, if people continue not wearing face masks in public spaces, do not avoid overcrowded settings, we are going to experience a resurgence much sooner rather than later.
Now, as far as super spreader events are concerned, I mean, we saw with the United States elections, since the first day of elections, the number of new cases a day has exceeded 100,000. As far as South Africa is concerned, what ought we to be learning from countries like the United States or even Europe that has already gone into lockdown in some of the countries?
Yeah, and I think that's a really important issue to emphasize, is that when you look at who's responsible for infecting others, it's about 10% of people that are responsible for 80% of the new infections that actually occur. So a minority of the population are responsible for the majority of infections that occur in the population. And the main reason for that is what you correctly termed as being super spreader events. And the type of super spreader events is not just about the mass type of rallies that we've seen in the United States, but even it's simple things such as going to a bar or going to a nightclub or going to a restaurant. Unfortunately, any setting that is a confined space where there's poor ventilation and overcrowding, those sort of settings lends itself to the super spreader events. And that includes places of worship. Now, the best thing that we can do in South Africa, in fact, the most effective strategy probably would be to minimize the chances of those super spreader events from occurring. That will assist us in terms of delaying the resurgence as well as slowing the rate of infection when there is a resurgence. So there's a few things that we can't sort of give up on. The wearing of face masks in public spaces, physical distancing as far as we can, but probably most important is limiting mass gatherings. We cannot go back to the pre-COVID era in terms of mass gatherings, because that will set us up for a resurgence much sooner than later.
In a very practical sense, though, Professor, we literally on the doorstep of the festive season, a time where South Africans traditionally spend time with family and friends and get together in large numbers. How are we going to prevent that from happening? Because those gatherings are in themselves pretty much super spreader events.
Yeah, so I think we're going to need to be conscious about the number of people that we invite to those gatherings. And when those gatherings do occur, most importantly, is those gatherings need to occur outdoors. It's much, much safer for having a gathering outdoors of 50 people than in a house or in a hall. Because like I said, what's really key in terms of the transmission of the virus is airborne transmission, something that we hadn't appreciated at an early stage of the epidemic, but for which there's compelling evidence now. And the way to sort of minimize that airborne transmission is to ensure adequate ventilation. So I'm not saying that South Africans shouldn't enjoy the vacation period, the festive period, but we're just going to need to be a bit more circumspect in terms of our behavior and, again, minimize those sort of mass gatherings, especially in poorly ventilated areas.
Well, thank you very much, Professor Madhi, for that update on how South Africa is faring right now as far as COVID-19 is concerned. And do remember that we are anticipating the president of the country to give a national address during the course of this week in regards to COVID-19. In his letter to the country today, he did warn South Africans to not be apathetic and not tire and continue maintaining the regulations for COVID-19.